If you could put a billboard in Times Square about the vagina, what would it say?
It would be about the pelvic floor, and I would say, don't push when you pee.
I was going to say, eat me.
The pelvic floor is a group of muscles that sit at the base of your pelvis, and it supports your bladder, your uterus, your bowels. It also has the openings in those muscles for urine to exit, and then the vagina for vaginal intercourse. So if you're experiencing issues with urinary leakage or painful sex or prolapse or tailbone pain, your pelvic floor muscles are usually involved, but they often just
I think I probably need pelvic floor PT, and I have never done it, nor do I know anything about it. And many of our listeners might not either. So tell us what it encompasses. And for someone like me, who honestly, I think I need it, what does it entail and how do we get started?
So I would say the first thing is...
Welcome back to this week's episode of Scrubs to Stilettos with me, Dr. Tiffany Moon.
And myself, Dr. Nicole Martin.
Today, we have a very special guest for you. Her name is Sara Reardon, better known as the Vagina Whisperer. She is a board-certified pelvic health physical therapist, educator, mom of two, and viral voice for vaginas. She has a new book coming out called Floored, A Woman's Guide to Pelvic Floor Health at Every Age, and we are so excited to bring her on to talk about all things pelvic floor.
I'm super excited about this because if you think about it, we have so many nicknames for the vagina. You know, the vag, the vajayjay, the kitty cat, the lady bits, the hoo-ha, like all of these nicknames for it, but no one really talks about it, right? Like we have all these names, but no one's talking about it. And there's so many things to talk about as a woman's life evolves, you know, pre-pregnancy, pregnancy, postpartum, menopause, like lots of changes happen to the kitty cat and we need to like get more comfortable talking about it.
Yes. So if you have a vagina or you know someone who does, please take a listen.
And if you haven't already done it, guys, make sure you hit subscribe, leave us a comment. It really helps us to grow our show, and it really ensures that you guys don't miss any episodes. But before we dive into the vajayjay talk, Tiff, do you have any weekly obsessions for us?
Okay, yes. This is my Hermès wallet that I use when I'm traveling. I have a normal Kelly wallet, which is ginormous and contains about 14 credit cards inside because 2 years ago, I got into this like credit card for travel points thing and opened up all these credit cards. Anyway, when I travel, I only travel with 3 credit cards. It's called the Calvi Duo. It's from Hermès, of course. And it has one side that's open and then this other side that has a button that you put stuff in and a side here. So it actually has 3 compartments and it's very small and compact and pink. So this is my weekly obsession. I think, don't hold me to this, but for the platinum girls for Lead Her Summit, which are like the VVIPs, I'm going to get customized Calvi holders for all the platinum ladies.
Wow, that's a very nice gift. Girl, you working for that Birkin.
I know. I need more pre-send.
I know where you're going with this one.
Please, if you don't know what we're talking about, please refer to another episode called Hermès, the Insider Game on Scrubs to Stilettos. Listen to that, and then all this conversation will make sense.
So this Mother's Day, my mom got me a new perfume because, as we will discuss, lots of things changed during pregnancy, and my olfactory, like my sense of smell, completely changed when I was pregnant to the point that I could barely use perfume because everything made me super nauseous. And I thought maybe after the baby was born that my sense of smell would revert back, and it hasn't. So I've had a really hard time finding scents that don't give me a headache and make me kind of feel grossed out. So she has been trying very hard to find me a perfume that works, and she got me this new one from Maison Francis, you know, the Baccarat guy. His nickname is Kirky, and this is his newest scent. It's called Kirky, and it actually smells delicious. It doesn't give me a headache like Baccarat. It still has similar notes to it, but it's milder. I would say if you like Baccarat, this is like a daytime version of that. But for me, I wear it all the time because I can't wear anything else.
Yes, I also have this and I agree. It is a good daytime scent and perfect for like spring, summer when you don't want that like heavy oud musk kind of, yeah, it's great.
Yep. So that's what I got for you.
Okay, we have the Vagina Whisperer. I want to know, did you coin that name yourself? Is it trademarked? How did you come up with it? Tell us all the things.
It is trademarked, actually. And I actually was given the nickname by my group of girlfriends after I started practicing as a pelvic floor therapist. They would occasionally ask me questions. And then one reunion in Massachusetts, we were at a friend's house, and I ended up talking in the hot tub with all of their moms about their bladder leakage and their prolapses. And my girlfriends were like, oh my gosh, she's like the Vagina Whisperer. So when I started my Instagram account, in 2016 or 2017, I started the account sharing tips for my girlfriends during pregnancy and postpartum. And so I called it what their nickname for me was.
And then how did you get it trademarked?
A trademark attorney. And it's actually very interesting because there was already a trademark for the Vagina Whisperer. And I was like, what?
No way.
I know. And it was actually, I don't want to kind of call anybody out specifically, but there's a surgeon who does vaginoplasties. He's a plastic surgeon, and he had trademarked the name. And so I just had to kind of file it in a different arena, which is the arena I'm in now, which is pelvic health therapy and wellness and exercise. But I was like, interesting, this kind of man is my competition, and he's talking about like rejuvenating vaginas, and I'm kind of coming at it from a very different like functional aspect. So
Okay, well, we only know one Vagina Whisperer.
You are the Vagina Whisperer.
thank you, ladies. Thank you.
In my eyes, as far as I am concerned. So give us a little bit of background about why you went into your specialty, why we should even care about the pelvic floor, maybe what the pelvic floor even is, because I am one for speaking correctly about things, calling things by their correct nomenclature. I got in a little
100 nicknames. I'm like,
I got in a little bit of trouble for correcting people. But yes, we spend a lot of time about the vagina. People definitely care about the vagina. The pelvic floor is not exactly the vagina. Why don't you give us a little anatomy lesson?
Vagina 101.
101, pelvic floor 101, baby. So the pelvic floor is a group of muscles that sit at the base of your pelvis. So when we see our kiddos with those skeleton jammies, or in the hospital clinics, you see those kind of bony skeleton models. And at the bottom of that pelvis is a basket of muscles, and it supports your bladder, your uterus, your balls. It also has the openings in those muscles for urine to exit, for stool to exit for bowel movements, and then for the vagina for vaginal intercourse, menstruation, and vaginal birth. So if you're experiencing issues with urinary leakage or painful sex or prolapse or tailbone pain or, skid marks in your undies, your pelvic floor muscles are usually involved, but they often people don't even know they exist. So when these issues arise, they don't know who to talk to about them. They don't know what's normal or what's not, because they've never been educated about their pelvic floor until often they're already experiencing a problem, and then it feels like it's too late. So I'm a physical therapist, and I have a doctorate in PT, and I specialized in this field right after grad school in 2007. I feel like a dinosaur in the field now. And I really just loved learning about my own body as a woman. I thought it was fascinating that there were muscles involved in all of these day-to-day functions. But then I also loved working with patients and helping them understand their bodies better and helping them overcome these really embarrassing private, intimate issues that were affecting their lives, like not being able to have sex when they want to start a family, or, not running or doing sports anymore because they were afraid of leakage. And these issues are so impactful on their lives, but they were just kind of hiding them because they didn't know what was normal or what was not and where to get help.
I know from personal experience, I really didn't, you'd read about Kegels and whatnot, but I never really thought about it when I was younger. And even with my first pregnancy, I'm going to say I came out of that relatively unscathed. Like I kind of bounced back and didn't have any issues. But with my second pregnancy, very early on, one of the first symptoms I had was urgency, and I was wearing difficult to tie pants. It was a struggle to make it to the bathroom, and I didn't even have a big belly at that point. And obviously, as the pregnancy progressed and my belly got bigger, the need and the urgency to go to the bathroom got worse. And I was like, okay, this is going to go away after the baby's born. And then you try doing a couple jumping jacks or jumping rope, and you're like, this is really not going away. And you realize the changes that happen with pregnancy and postpartum, and probably also getting into your 40s, it's a real I did PT for my pelvis.
Yeah, I
afterwards.
love that. And I think that until one, like you're in the medical field, right? And so like you went through med school and residency and all these things. And I think we just don't realize that these muscles do change at different times in our life. Like I titled the book Floored, A Woman's Guide for Every Age and Stage, because pregnancy, giving birth, and menopause are the three biggest risk factors for developing a pelvic floor issue, where pelvic floor therapy should 100% be standard of care. But even when you are a young athlete and you are a cheerleader or a volleyball player, or if you become sexually active and have painful sex, or when you have your period and you have pain with periods or can't use certain products, those are all times that pelvic floor issues can also arise. And yet we don't address them, or again, we don't even know that we need to. And so to your point, I think it's often not until we have a problem that we start addressing it. But I love that you went to therapy, because now you'll be like, pee your pants, like get going. Like there are people out there that can help.
But that's the beautiful thing about social media and accounts like yours. I didn't even know about pelvic PT, to be honest, and I'm a physician. I only knew about it because I saw a girlfriend going to pelvic PT and she was posting it on her social media. And I was like, oh, what's that? And she talked about it and I was like, oh, I need that in my life. So it's one of the nice things about social media is that you have this information that's accessible to you so that you can learn things like about pelvic floor PT.
Well, I think I probably need pelvic floor PT, and I have never done it, nor do I know anything about it. And many of our listeners might not either. So tell us what it encompasses. And for someone like me, who honestly, I think I need it, what does it entail and how do we get started?
So it's, when you go see a physical therapist, you think of being in a big gym setting and there's like multiple patients and you're doing exercises. And one of the questions I get asked while I was like, hey, Sarah, what do I need to wear to my therapy session? I'm like, nothing. Like you're going to be getting undressed. So let's just put that out there right away. Wear whatever you want because your clothes are coming off. But what we do is the first thing, it's in a private treatment room. So it's not in a big gym like that. You sit in a private treatment room one-on-one. You're welcome to have a partner or a friend or a chaperone in there if you'd like. And then we ask you a lot of questions. So you may be in there, Nikki, to talk about urinary leakage, but I want to know like your childbirth history, your menstrual cycles, your exercise, your life, like get a real picture of what does Nikki's life look like? And are there any other pelvic floor issues we need to talk about, like pooping or painful sex? And then we do an external examination where I look at, and this is with clothes on, I'll look at your hips, your pelvis, maybe your abdominal wall, if you've had any abdominal surgeries or C-sections, if you have core weakness. And then I'll say, okay, I'm going to step out and you're going to get changed. And then you undress from the waist down. So pants and underwear are off. You lie on a comfortable table and you're covered in a sheet. And then the therapist comes back in and we say, okay, we're going to pull the sheet back. We do an external assessment of the vulva. So we're looking at skin color, tissue, scarring, looking for any kind of hormonal changes. And then we do an examination by inserting a gloved finger into the vaginal opening. And I say, okay, I want you to do what's called a Kegel or a pelvic floor contraction and see how well you contract and then how well you relax. And then I want you to push your bear down like you're pooping or giving birth. How well can you lengthen the muscles? And then I press on the side walls of the vagina, and that's where the muscles are to see, are they tight or tender or tense? And that gives me some information. Is this a weakness issue and we need to work on strengthening the pelvic floor? Or is it a tension issue and we need to relax the muscles first? And kind of which pathway we need to walk down, because Kegels are a strengthening exercise, but if you have tension, it could actually make your issues worse.
Okay. Nikki, is this on par with what you've experienced when you went?
So I had an emergency C-section with Genevieve, and Grayson was also a C-section. So I never birthed a child through my birth canal, but I actually had some adhesions of my bladder to almost like my scar, I guess, like where my C-section was. And so we had to do a lot of like scar manipulation and suction cups and all sorts of things to release my bladder, because that was part of the reason why I was having so much urgency. So I think that's why the initial evaluation is so important, because there are multiple parts of the pelvic floor, right? And there are multiple different things that can be happening. Like I have a girlfriend who went to the same physical therapist as me, and she had like really tight muscles and was having a problem like evacuating because her muscles were so tight. And she would get massage, like transvaginal massages basically to like loosen up the muscles. I'm like,
Transvaginal massage. Wait a second.
Yeah.
That is what I do all day.
like she would go in there and like push on
Yeah.
stuff. And
You
she,
do
and
this all day. You put your fingers inside someone's vagina and massage it.
Yeah, and it's like coffee talk while we're like doing my.
like, how are the kids?
Totally.
And you're like, pushing
Yeah,
the
100%.
lateral
What'd
wall.
you do this weekend? Like, how are things with the hubs? Yes, yes. And think about it. Like, if you have tension in your neck or shoulders and it's causing headaches or migraines, or you have jaw pain and it's causing TMJ, like you would do stretches or acupuncture, but then also massage to the area. So we do exercise and breathing and stretching and, like Nikki said, cupping or dry needling. So there's a lot of other things that we do. But just like I would massage your cesarean scar, which is something that I recommend everyone who's had a C-section get done, I'll also internally kind of press, release tension, or massage through the vagina to release the muscles. And it really is like, I'm sure, Nikki, when you were going, it was like you would just kind of shoot the shit with your PT. It's the same thing.
How many sessions did you go to?
Oh, I started like while I was pregnant for like my lower back and like, hip things. And then she saw me afterwards. And then I had like a little bit of that shelf, kind of that C-section shelf thing happening. That's not really cute. I don't know. Did you have a C-section, Tiff?
No.
Oh, so I guess you get like some scarring from the scar, and then like your skin and like subcutaneous tissue kind of like hangs over, and it's not cute. So we worked on that a lot. And then I did have some diastasis. So we did a lot of like learning to breathe and how to like zip up your core, which is amazing. And I can't remember the name of the breathing thing. It's like
diaphragmatic breathing or hypopressives.
Hypopressives, which are so hard but so good. So yeah, I did a lot of pelvic floor therapy.
I mean, you had a great therapist. Like, this sounds like an amazing experience.
It was wonderful, but like you said, I wish it was standard of care, right? I wish it was something that was more openly involved, like discussed. And then I wish it was something that was also covered by insurance, because I think for most people, it's very expensive. And with a new baby at home and lots of things that you need to buy for the baby, it's probably a luxury for a lot of people to spend this money. And it's just, I wish it was different.
Right. And I think that some pelvic health therapists are what we call in-network, as you all know. So they work for hospital-based systems or clinics that do accept insurance. A lot of us are out of network. And the reason for that is we spend one-on-one an hour with the client. And so it's a lot of time. And so kind of in the traditional PT setting and the way insurance is reimbursed is you're seeing 2 to 3 clients an hour. And I'm like, I have 2 hands. Like, I can't like sit in the middle of a room and then put a hand on each wall through each wall to be like one patient here, one patient here. Like, you can't do that. Right. So, I mean, it's a very individualized type of care. And, I get the question a lot, like, why did you write floored? And this is the type of therapy or the type of healthcare I think that needs to be really accessible. When you go to a bookstore or anything, it's like there's hundreds of books on nutrition and meditation and, supplements and now menopause. And I'm like, there's nothing on the pelvic floor. And yet this group of muscles like affects every single aspect of our life, from how we breathe to how we have sex to how we birth babies to how we exercise to how we pee and poop. And so I just really want like the basics of the education to be out there and to give people tips and guidance, that are really accessible so they can start at home.
Yeah, absolutely. I think there's this mentality, right, of, oh, this is just part of it. Like, oh, you had a baby, now you're just going to pee every time you jump rope. Or you're getting older, sex is supposed to be painful. Like, you're not supposed to be as lubricate. Like, there's just this acceptance that this is the way it's supposed to be. But to a certain extent, we can mitigate those changes and we can improve the situation. We don't have to just blindly accept that reality.
Yeah. And I mean, I had really great births, and I had physically, I would say the rest of postpartum was kind of a shit show, but I would say physically, from a vagina perspective, like I had a great recovery. And I was like, I think so many more people deserve this experience. Like, why did I, Sara, the Vagina Whisperer, just happen to pick this field where I knew how to take care of my body? I knew the tips and techniques, and with some luck and some support, like my vagina showed up for me. And I think more women deserve this, and it can't just be the people who see me in Dallas or New Orleans or, find me on social media. I feel like this needs to be, as you mentioned, like the standard of care.
Yeah. For people who are kind of new onto this topic and just starting to get in touch with themselves, what are 3 practical strategies that women can practice to improve their pelvic health?
So I think one of the things to really think about is like, if I could teach everybody 3 things, the first one would be how to pee, because it's something we do 6 to 8 times a day. And if you're not doing it properly, it could really affect and almost like weaken your pelvic floor.
Oh,
So
I don't think you know how to pee.
Yeah,
my
I'm
gosh.
like, I've been
I'm
peeing
going to
all
be
wrong.
with, yeah.
I've been being wrong my entire life. That's a lot of pee. Oh, whoa.
Exactly. Well, you might be doing it right, ladies, so don't stress. But always tell people like pee when you have the urge to pee. So don't overhold it, which I'm sure as physicians, you are like holding it for way too long. And then when you finally go to pee, you can't relax your muscles. And then you have to push or strain to go. And that can weaken your pelvic floor. So go and don't go all the time either. So like just in case, we call it just in case peeing. So every time you leave the house, every time you're about to go into surgery, every time that you arrive somewhere, it's like we pee just in case, but that can actually cause your bladder to shrink. And then you get urinary urgency where you have to pee every like 30 to 45 minutes and feel like you never are empty.
Oh my goodness. I tell my kids to pee just in case all the time.
Okay,
I'm like, okay, we're leaving the party. There's going to be traffic. Pee just in case.
I know.
And when they say, I don't need to. And then I say, go anyway. This is so bad. This is so bad.
Bladder.
So when they're little, like, when my kids were 3, 4, 5, yes. But when they're older, I'm like, okay, if you don't have to pee, then don't pee. But like, if you haven't gone, the normal range to go is every 2 to 4 hours during the day. So if it's been, kids, they'll want to go like 5, 6 hours and not go. But if they went an hour ago, they don't need to go again. But these are habits that we learn when we're younger or when we're pregnant or when we're working, and we don't adapt them. The other thing is when you pee, you need to sit down instead of hovering over the toilet. So that helps your that helps your pelvic floor muscles relax. So line the toilet, put toilet paper on it. If it's really gross, then hover, that's fine. But if you can, sit. And then the top tip is don't push when you pee. So as moms, as working women, I feel like we want to be so efficient and try to get everything done and move on to the next thing. So we power pee and try to get it out as quickly as possible.
I am confirming that I've been peeing wrong my entire life.
Yeah.
So
it's definitely like a forceful push.
Right.
Yeah, no. I gotta go. I got stuff to do, Pete.
No. So
and also because I've been holding it for 4 hours,
Right.
So chill, sit, chill, lean forward and just take some deep breaths and just let it flow. Even if it goes slowly, just like let it flow. Then like shake your hips at the end, wipe and walk away. But don't push.
Okay. I shall pee better from today forward.
Yes. I mean, look at this. You're changing lives already.
Yes.
One pelvic floor at a time. The second thing is pooping, because straining with a bowel movement weakens your pelvic floor more than running, jumping, coughing, crunches. And if it's constipation is the number 1 GI complaint in the US. And so all of the folks who are straining with bowel movements can develop prolapse, weakness, like never having given birth. So when you poop, obviously go when you have the urge to go. Don't delay. And then sit on the toilet seat and then put your feet on a stool, like a squatty potty or a step stool. And that puts you in a squatting position, and that relaxes your pelvic floor muscles to empty the tank better. So it's a much more kind of effective way to empty your poop. And then if instead of straining and holding your breath, you need to breathe out. So I always say like breathe out like you're blowing out a bunch of birthday candles. Or for my kids, those little twirly plastic straws you get at birthday parties, I just keep those in the bathroom and then they blow through them to help them bear down to empty. And adults can do that too. But don't hold your breath and then elevate your feet.
Well, I mean, I've been pooping all wrong. First of all, my poo gets off schedule when I travel.
Yep.
Oh yeah, vacation constipation.
That's real. I have these Miralax to-go packets that I put into like some coffee or something to keep my poo regular. And I read a statistic somewhere that most mammals in the world take 12 seconds to poo. So if you are on the toilet pooing for more than 12 seconds, then like you've got problems. And I was like, I've got big problems. Yeah. Like I'm on there for like 5 minutes.
Yeah, but you're on there like looking at
Instagram. Scrolling.
Yes, but also
straining from the kids, like
yeah, and what is the fiber? Like 30 grams of fiber. I don't even think I'm anywhere close to that. So I think a lot of my pelvic floor dysfunction is probably from number 2, bad habits.
Yeah. And so when I travel, which I know you've been traveling a ton for your book tour and I've been traveling a ton, I actually take these magnesium gummies by Natural Calm, and it's a magnesium citrate gummy, and I take 3 to 4 a night. So like when I know I'm traveling, I'm like, push the water, take those at nighttime, and it helps keep your bowel movement soft. Whatever you do, you just have to be consistent. So instead of like taking the gummies and then not taking them and then getting backed up and taking them again, I'm like, just be consistent. So take your Miralax every day or take your gummies every night. Drink water, hydrate, but your poop should be coming out like TCBY soft serve, like smooth. I know.
I was so constipated during both my pregnancies, even
Yeah.
even early on. Like, it wasn't a product of a big gravid uterus. Very early on, I was extreme. I must have been like a hormonal.
No,
change.
it's the progesterone. You have like a surge of progesterone, which causes constipation. And so your colon gets so sluggish. And the same thing happens actually right before your period, your monthly period. This is like all the bloating and the constipation. It's because of the surges of progesterone.
Wow.
Good
Yeah.
to know. Didn't
Yeah, I was on
that day
Miralax.
of med school. I don't know. And then what was the third tip? We've been peeing and pooing all wrong.
So actually, it's actually really simple, and it's exhale with exertion. So what this means is that if you are lifting weights at the gym, if you are lifting a stroller into your car, if you're pushing a piece of furniture, anytime you're exerting effort, don't hold your breath. Because what happens is when you hold your breath, and this happens with pooping, like you hold your breath to strain, or when you're lifting heavy weights at the gym, you hold your breath, and that weakens your pelvic floor. What happens is that it's this thing called pressure management, where all of this pressure gets trapped in your abdominal and pelvic cavity, and it's going to look for the path of least resistance. And in women, and especially postpartum and aging moms, the vagina is the weakest point. So you end up getting prolapse or hemorrhoids in the anal area. Sometimes people get hernias. Like a lot of weightlifting men get hernias because they just strain and hold their breath. So exhale with exertion. Like when I was lifting my kiddos into the car all the time when they were little, I'd go, okay, buddy, 1, 2, 3, and exhale. When I'm lifting weights in the gym, I'm like, exhale with every repetition. So you have to kind of learn to engage your muscles, like your pelvic floor and core, and breathe when you're doing these day-to-day activities. Because you could do Kegels till the cows come home, but if you're picking up your kids 20 or 30 times a day, not contracting your pelvic floor, holding your breath, it can weaken your muscles over time.
Speaking of Kegels, are they helpful? What's the best way to do Kegels? Like, do we do them every time we're at a stoplight? Like, or what's like the trick so that we know, what's a feasible way for our listeners to incorporate Kegels into their daily life?
Yeah. So first of all, you have to make sure that they're appropriate for you. So Kegels are pelvic floor contractions, like closing the vagina, stopping the urine stream, holding in gas. So it's like a squeeze of the front and the back. One way to test if you're doing them properly is if you're peeing, you only try this once, because I don't want you doing Kegels all the time when you're peeing. You should be relaxed. But if you're peeing and you want to stop your urine stream, that's a Kegel contraction. So it kind of helps you connect mind to body. But if you have weakness, then you can do pelvic floor or Kegel contractions, quick ones where you squeeze and then relax, and then longer hold ones where you hold for 5 or 10 seconds and then relax. The relax is just as important. But you can't just do them sitting in the carpool lane, because you don't leak just sitting in the carpool lane, right? You leak when you laugh, cough, run, jump, stand, walk to the bathroom. So you have to use the muscle in different positions and start turning it on before a cough or a sneeze, or kind of with exercise. The only challenge with this is a lot of people have tension in their muscles, like so many women after birth, stressed out, pooping problems, all the things, and Kegels make that worse. So in those situations, you need to work on diaphragmatic breathing, yoga, vagina massage, like all of the things to relax the muscles before you do strengthening and Kegels.
And those weighted balls that you're seeing now, would that only be beneficial for people with pelvic floor weakness? Because if you're too tense and you put that in, then you're going to make the muscles more tense.
Correct. You hit the nail on the head, Nikki. So yes, these Kegel weights or eggs or, balls, they are different weights. And so you start with one that's a little bit less heavy. And then it's actually really helpful to give your muscle something to squeeze around, because a lot of people can't tell when they're doing contractions. But you can't just pop that baby in and then walk around for 30 minutes and be like, yeah, I'm strengthening my vagina, because it's like you don't walk around with a bicep curl and be like, oh, I'm strengthening my bicep, right? You have to contract and relax the muscle. So you should do contractions or Kegels with it in, but eventually you don't need those anymore. You can up the weight and kind of gain a resistance, but you can't just walk around with it tight. You have to contract and relax, and then just make sure that you're relaxing fully afterwards. So they're a tool, but eventually, again, you need to bring this into your workouts, into Pilates and bar and just day-to-day activities, so you don't have to always kind of use those devices.
Okay.
If you're like, you are mind blown.
I was like taking mental notes. I'm like, do I need to buy some vagina eggs and add like vaginal exercise to my to-do list? Because
I know this is so true. I know.
I was looking at you and I was like, is Tiffany doing Kegels right now? Like,
no, I can't do Kegels and think and talk at the same time. Like, I think honestly, I need to find a good pelvic floor therapist in Dallas that I can see, because this problem has been ongoing. Like, my allergies have been so bad because I'm allergic to my new dog. That's a long story. But I will sometimes sneeze and pee, and then I have to go change my pants, and it's embarrassing. And
it's totally embarrassing. Yeah. Yeah. I mean, I started playing tennis at 40. I was like, I don't know why I picked a new sport at 40 to start. And then a year or two in, I like did a quick sidestep and I like was like, oh my God, I think I just leaked. And like, I could not focus for the rest of the game. Of course, it was the day I was wearing like hot pink yoga pants. I'm like, oh my God, can you see it? And I'm like, I'm the Vagina Whisperer. Like, I can't leak, you know? So I'm like, I mean, Sarah, get it together. And so, but then I really have spent the last year like very thoughtfully strengthening, because I'm perimenopausal, but also like doing my pelvic floor exercises with my workouts. Like, and it is so much better. I mean, it's just, you don't know what you don't know. So again, I'm so grateful I have this, like, I know what to do for my body, but I want everybody to know that, because it doesn't get better is the hard part. Like, the little leaks now don't get better once we're perimenopausal and menopausal and our hormonal systems can't prop us up anymore, or we're aging and muscles atrophy. So we really need to be proactive about it, because these issues, it's like you can see like the yellow light flashing and we're like, okay, we have this runway to kind of really care for ourselves until things start getting worse.
Speaking of perimenopause, I think we're all in our 40s.
Yeah.
Right? So it's happening. What can women expect in terms of changes to their pelvic floor as they approach menopause? And
So
how
one
can
of-
we stay ahead of that?
Yeah, I love that. And I think some of that like early pelvic floor signs you'll start seeing are you'll start peeing more frequently. So you may be like, oh, I'm waking at night now, like once or twice, and I never used to. Or you have to pee before bed and you're like, God, I feel like I just like can't go to sleep and I just keep feeling I have to go. So kind of more urgency, more frequency, more leakage. So myself, like doing the same things, and then all of a sudden now I leak when I cough or sneeze or kind of take a quick sidestep. Kind of those early bladder changes. Other things you might see are like staining in your underwear from like after bowel movements, feeling like you can't clean well, hemorrhoids or kind of fissures in the area. That's just a sign of like either weakness or tension, that like your muscles are weakening over time. But one of the bigger ones is pelvic floor changes to your vulva and your vagina. So you get vaginal dryness, vulvar dryness, itching, irritation. Sex can become more uncomfortable because you don't have as much lubrication in the area. And that's all due to lower estrogen levels in the vulva and vagina. There's a lot of estrogen receptors in that area. And when we have less estrogen, when we're perimenopausal and then postmenopausal, we get dryness, thin tissues, weaker muscles in the area. So I'm a huge fan of proactively like moisturizing the vulva. I'm like have a vulva care routine, where just like we have a skincare routine, we need to use like a good vulva balm. You don't need to wash your vulva with anything specific. You can just use water. But if you want to use something, there are specific vulva washes that are pH balanced. But then I also really encourage topical estrogen cream for the vulva and vagina. Like there is nothing that's going to help plump up those tissues better, keep your labia, your clitoris, your vagina like supple, soft, lubricated without topical estrogen. So I'm like, the sooner the better, and till death do you part forever.
I am by no means an OB-GYN, but I actually just had my annual visit with Dr. Jilla, one of our friends who's kind of like a concierge OB-GYN doctor. And we spent quite a lot of time talking about the vagina changes in perimenopause, and how I think there's like a little bit of apprehension about using estrogen, because women, you hear so much in the news about estrogen and hormones and increased risk of cancer. And so we discussed the vaginal application of estrogen, and she kind of told me that the systemic absorption is negligible. So really, you're reaping the benefits of improved pelvic floor and vaginal health without the increased risk for breast cancer. And she says you apply it twice a week. And that usually does the trick. And then I was like, well, is that bad for your man? And, you're exposing him to estrogen. And she was like, it's fine. She's like, it's twice a week. You can try to time it when you're not going to have intercourse. She's like, but if you happen to put it in and you have intercourse that night, she's like, no big deal. So for our listeners, although we are not OB-GYNs, this is coming from one of our listeners and one of our friends, and I think Dr. Sara.
Yeah, and I'm not one either, but it is hands down. I mean, I've seen thousands of vulvas in my day, and I can look at them and be like, this is a de-estrogenized vulva. Like, I mean, I'll do internal examinations and there will be pink on my glove because they have tearing, because the tissues are so thin. You can see their labia start to resorb, their clitoris, their clitoral hood kind of start to get fused down. And I'll see these early changes. And I'll say, like, I think you need to talk to your medical provider about this as an option. And it's not, I mean, I think it's a piece of the puzzle. So I also encourage using a vulva balm or moisturizer. You still have to do your pelvic floor exercises. But we're living until we're 70 or 80 now, and we're in perimenopause by 40. And I'm like, we have another 40 years ahead of us that I'm like, I want to have good sex. I want to have orgasms. I want to exercise. I want to feel confident in my body. And I think we deserve that. And I also think we need to give people options, like know the risks and the side effects, but it's up to us to kind of make the choice, but we do deserve to have the options of whether we use these things or not.
Is a vulva balm different from just like regular lubricant, like KY lube or any of that stuff? I've never...
Yeah, so I know I have like a whole closet behind me, girl. So just like get these samples.
Send us some vulva balm.
Tiffany gets like purses, and I get lube, and I'm like, that's like, did I pick the wrong field? Like, am I need to be a different kind of influencer? And so I get a lot of lube, and so lube is specifically for intercourse, so vaginal intercourse or anal intercourse, but specifically vaginal intercourse. So, and actually people don't even know how to apply it. So I tell people to like put it on your partner, like put it on a penis, a dildo, a finger. Like if you have sensitivity, you can put some at the vaginal opening, but it also needs to be on your partner. So that will make for less friction and more comfort. A moisturizer or a balm is something you use on the regular. Just like after I get out of the shower and I lotion my face and I put on my serums on my skin, on my, then there's an oil-based balm by Medicine Mama called Vulva Balm. There's other ones, like Stripes has one that came out. Diva has one that came out, Kindra, and they're specifically for the vulva externally. So you put it around the labia and the clitoris, and it's just like it's a lotion, but it's specifically pH balanced to not disrupt the microbiome in that area.
I am going to put that on my to-do list because this is TMI, you guys. You know about my constipation. Now you have to learn about my dry vulva. Like, it's just not as like plump as it used to be.
That's where it's at. The plumpness,
Like, it's just kind of, it looks shriveled.
Instead of being like a little hamburger, like a little fluffy.
It's kind of like shriveled, like it's wrinkly.
I would I would look into topical estrogen and then use a daily vulva balm the days you don't use the estrogen.
Okay.
Yes.
Yeah, I agree. I mean, I think it's and like you said, it's not going to get any better, right? As you age, your estrogen's just going to continue to decline as you enter into menopause, and these are just going to become bigger issues. So if you can get ahead of it and not have that like atrophy and that dryness and the tearing and all of those scarring things that can happen, it's like makes for a much better 40 years.
Yes, because our average life expectancy several lifetimes ago was like 55 years old. Like you would die because there was no penicillin, a wild saber-toothed tiger would get you or something like that. You'd get a cut, it would get infected, you would die. You got pneumonia, you would die. And now we're living into our 80s, but like my mom, she's been menopausal for over a decade and she cannot like run, jump, cough, sneeze. And she just, when I talked to her about it, she was like, oh, that's just how it is. Like, grandma had the same thing. I have it. You're going to have it. And I think for so long, women have just been taught, like, that's just how it is. That is just the consequence you bear from being a mother or whatever. And the truth of the matter is, it's not. Like, you don't have to put up with it. Like, we can be empowered to educate ourselves and do something about our pelvic floor health. And I think that's why your book is so important.
Thank you. And it's one of those things. I mean, I feel like we're penalized for having vaginas, for being moms, and we also are having babies later. I mean, I think that now more women are having babies in their 40s than they are in their teens. So we're going from pregnant to postpartum, maybe another kiddo, lactating, which causes dryness and atrophy, and then we're perimenopausal. So it's like, it's one blurry season where we're all of a sudden we're like, wait, what's going on with my body? And like, what can I do? And so it's very confusing and overwhelming, but there are things that can help manage it and make it less overwhelming and frustrating. And a lot of these issues that, as your mom said, like, we were told it was just normal, they're very treatable. I mean, this is not like rocket science that I do. Like, we're sending people to Mars. I'm like, we can teach them how to train their pelvic floor after birth. We just have to prioritize the care of women. And it hasn't been the case in the US medical system.
That's always been such a source of frustration because, just examples. Men are having erectile dysfunction. They can get Cialis, they can get Viagra. We have all these medications that insurance covers. A woman's having sexual dysfunction and Addie's not covered by our insurance. We do penile implants all the time at my job for erectile dysfunction, but a woman can't get her IVF covered because infertility is not a medical issue. Like, there's all these things for women's health that are just lagging behind. And hopefully, with people like yourself in these books, it draws awareness to these issues, and we get to a point where we receive the same care and coverage that male issues receive.
Yeah, totally. And it's hard because I know, Tiffany, you were like, wait, do I need to do all this stuff now? And I don't want any of this stuff to be a life overhaul because it's really quite simple, but we just learn it all at once. But I'm literally like, okay, just don't push when you pee. Use a stool under your feet when you poop. Like, don't hold your bladder too long. Like, use a great lube when you're having sex. Like, it's these things that are kind of tips that should be trickled in throughout our life, but we don't get them until it's very late. And one of the things I get asked all is like, hey, when should we start educating like kids about this? And I'm like, when it's like age appropriate. But I mean, I start the book at periods because, people have daughters and I think it's like, we need to educate them on like, what's the vulva? Where do you find the vaginal opening to insert a menstrual hygiene product? Pain is not normal for periods. It's actually an early indicator of endometriosis if it's affecting your quality of life and not managed with ibuprofen. It's like, but so women are suffering for years. It takes 7 years for someone who has vulvodynia or pelvic pain to find a specialist and a diagnosis. And I'm like, that's insane. Like that's insane, And so I just think the earlier we can educate the next generation, I feel like their radars will be going off of like, oh, wait, something's not right. I think I need to see somebody versus it's, they're 50s, 60s, 70s. And they're like, okay, how did I get here?
Yeah, so many people have lived with it, the pain, the shame, and not to even mention the amount of gaslighting that has happened because they go to somebody and they're told it's all in their head. I mean, like the root word of hysterectomy, which is surgical removal of the uterus, and the word hysteria is the same Greek root word. And there is some connotation that, like, oh, she's just crazy, right? Like, and it's just the amount of gaslighting that's happened in the medical community for women has really set us back in a lot of ways. So I think having your book, having the education, and having someone explain it in such a easy to digest manner is really doing such a great service for women and the men that care about these women.
Totally.
If this topic is resonating with our listeners, if they're like, oh, I think I have a problem, I'm noticing these things, where can they, like, what should be their first steps? Do they go see an OB-GYN? How do they find a pelvic floor therapist in their area? I was lucky enough to find one through Instagram on a girlfriend's page. But if you live somewhere else, is there a pelvic floor therapy database or?
Yeah, there is. I actually have it in the back of my book too. So I would say the first thing is, and sometimes people just need to kind of understand their bodies and get this demystified before they're ready to take that leap into see a therapist. So I would say I would Google, and you can literally look up pelvic floor therapist near me. I would talk to your girlfriends. I would go on, there's two websites. One's called pelvicrehab.com and the other is the Academy of Pelvic Health. And both of them have PT locators where you can type in your zip code or your city and pelvic floor PTs come up in your area. And you have to find the right one. I mean, it's not going to be, sometimes there are some that are more experienced. Sometimes the energy is off. It's kind of like finding a therapist. You have to find somebody you feel really comfortable being vulnerable with and it feels like the right type of treatment for you. And then you can also talk to your OBGYN or your primary care. But I will say, I don't think we work as closely with OBGYNs as I would like. Like Urogyns, yes. I don't know what the disconnect is, but I really wish that there was a way that we could work more holistically because during pregnancy, women start having these issues. If we can see them postpartum, we can kind of navigate recovery earlier. It's just not, the systems just aren't as integrated as I would hope.
That's
that
a shame.
we move. It is a shame. And so, but I think OBGYNs are like so overworked right now. I mean, they have insane caseloads and like I get the pelvic floor is top of my mind, but they have a very different kind of something bigger that they're focused on as well. I'm on Instagram as the Vagina Whisperer, and then my book Floored comes out on June 10th. And there's just there's a ton of information that I think will help women, will help their partners, will help their medical providers, because I think a lot of physicians don't know a lot of this information because it's not integrated into training programs yet. And it will just kind of help just like, what is pelvic floor therapy? What do they expect in a session? How do I know if I need help? And just answer a lot of the questions that I think people have, but maybe they're just not quite ready to kind of like take the leap yet too.
Yeah, no, I love it. Thank you so much for coming on and teaching us about the pelvic floor. I have some lifestyle modifications that I shall add, and I will be Googling pelvic floor therapist near me.
Sarah, before we finish up, we thought it would be fun to end on a little like fast Q&A. What is the one interesting fact about the vagina?
That it's separate from the vulva. I think people don't even realize that those are two separate things. So the vagina is a canal and the vulva is everything kind of external. The vagina is internal. So that's kind of the bare facts, right? The basic facts right there.
If you could put a billboard in Times Square about the vagina, what would it say?
It would be about the pelvic floor, and I would say, don't push when you pee.
I was going to say, eat me.
Tiffany would. I'm like, let's talk about peeing. You're like, no.
Let's talk about cunnilingus.
I mean, yes. Okay. Last question. What is the biggest pelvic floor myth that you wish would disappear forever?
That Kegels are the answer for everything.
There you have it, ladies and gentlemen. Kegels will not solve all your problems. That's it for our show. If you have enjoyed listening, please subscribe, leave a review, send this episode to a dear friend of yours who has a pelvic floor who you want it to be more healthy. We have so much enjoyed having you on the Vagina Whisperer. Thank you so much.
Thanks for having me.
Thanks, guys.